Hello everyone. Today we are going to talk about stomach ulcer. Have you ever had pain or a burning sensation in the upper stomach? Have you ever vomited blood or passed dark or black stool? Well, you may be suffering from an ulcer in the stomach wall, which is a very common disease. There are several causes of stomach ulcers, but the most well-known are Helicobacter pylori infection and the use of analgesics like NSAIDs, which will be the focus of our current discussion. During this video, we will explain to you everything related to stomach ulcers, their causes, symptoms, and how to treat them and prevent any complications from it. So our role today is to answer most of your questions regarding stomach ulcer. Today we have Dr. Lee, who is the leading doctor at Hanyang University Hospital. He's going to discuss with us everything about stomach ulcer from an experienced medical point of view. Hello, I'm Ume. Before we start, please subscribe to our channel so that next time you will be updated with our new releases. What is exactly a stomach ulcer, and is it very dangerous?
So we call this an ulcer. To simply put it, the stomach is wounded. When we are tired, we get inflammation in our gums, right? Likewise, the stomach and the duodenum are peeled off. This is dangerous. Usually most common ulcers get better with medication. But sometimes ulcers can develop into cancer. So it's important to know whether it is a simple ulcer or an early stage cancer. For this reason, we always do a biopsy, even for very small ulcers, to determine if there is a possibility of malignancies. If there aren't any, it is said that if you take 2 months of medication, you will get better. In that respect, ulcers are important, and in some cases, they can be seen as dangerous.
So in some cases, cancer and ulcer can be similar.
Yes, they can be similar.
So what are the first signs of ulcer?
So when an ulcer occurs, the symptoms, when we have ulcers on our gums, it hurts our mouth, right? Likewise, if there is an ulcer in the stomach, it hurts. You feel sore and sick, and sometimes you wake up from heartburn when sleeping at night. And you don't digest well, have no appetite. These can be seen as early symptoms.
And ulcer can have many types as well?
I mentioned earlier, when you have an ulcer, it's usually not a bad ulcer, but a common ulcer that gets better with medication. Sometimes malignant ulcers or cancer can be hidden, so they can be divided into 2 broad categories. So benign ulcers and malignant ulcers. Most of them are benign ulcers, but sometimes malignant ulcers can be hidden. So it is important to diagnose a hidden malignant ulcer well.
So the stomach ulcer also depends on the diet, alcohol, if the person is smoking, for example.
So alcohol can be the cause, cigarettes can be the cause. But various drugs can also be the cause, as medication drugs are important. So for people with ulcers, look at all such things as alcohol, smoking, and drug use, and look for the cause. And if the cause is one of them, and you stop consuming, so you could get better. Obviously, if you have ulcer patients, you should look closely at your smoking history, drinking history, and see if any of that was the cause.
So today, the doctor explained in detail everything related to stomach ulcer, including its causes, symptoms, and management. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below, and we'll respond to you as soon as possible.